afternoon, Dan. How are you doing today?
Afternoon, all good, thank you.
Excellent.
Yeah, very nice to see you, Jan.
It's lovely to see the pair of you, and you're both looking well. Dan, Kirsty, thanks for getting together with us today. I really would like to just get your story out around the service that you're delivering down at Worcester and over at the Alex in Redditch. Would you like to tell us a bit about the service you're delivering around SDEC, please?
Dan?
Yeah, so I'll go first and I'll talk about what we're trying to achieve and what we've done so far. So within the Worcestershire Acute Hospital Trust, we set up 2 same-day emergency care departments. They're made up of AEC, so ambulatory emergency care, and our acute medical unit, and inside that sits our medical triage unit. So what we've aimed to do as the same-day emergency care is take all referrals to medicine by GPs. These are referrals from accident and emergency, and we then we stream through those referrals, and we then see if we can get them through the ambulatory emergency care departments or through the acute medical unit, with the aim and the philosophy being to try and see, treat and discharge safely these patients on the same day. That might involve doing their treatment, sending them home, bringing them back, reviewing them in clinics, or doing follow-up tests and so on and so forth. But fundamentally, what we managed to do across the Worcestershire Acute Hospital Trust is we now see about 40 to 50% of our medical take through the same-day emergency care pathways, which has now freed up almost 50% of our bed capacity within acute medicine, and therefore meaning that we got better flow through our emergency departments. We've got better access for the GPs to get their patients directly into medicine rather than them having to sit in ED corridors and things that we were experiencing a year or 2 ago. And that's working really well for us. We've also opened the doors now to West Midlands Ambulance and to the 111 service. Both sites now have an independent phone line that I believe the number will be at the end of this podcast, which allows the ambulance service to refer directly into same-day emergency care for medicine. So when they're out on the road and they see anybody that they think actually you need hospital but you don't need accident and emergency and you have a medical problem, we've got a number that we can get and get these people seen in the right place at the right time. And it's working really well here in Worcester.
Excellent. Kirsty, would you like to add anything?
Yeah, thanks, Dan. I mean, you've encompassed quite a lot. We've been working to try and have a dedicated space on both sites that allows for the safe management of ambulatory patients as part of the SDEC mindset. And now we're there, we've taken some work, but we work very closely to provide the same service across all of the county, predominantly ACP-led, which we're really proud of. But it does incorporate a very specialised expert triage service, different to other regions, and we're really proud of. And this allows us to take a real wide scope of medical presentations. We don't much have a criteria. We have a grasp of anyone that's well or with a news of less than 4 that has a medical problem. If a sensible adult can manage and we can manage their care within 12 hours, making real headway and getting a patient home. Triage is all about getting, as Dan said, the right person to the right place first time. And I think as a county, we're selling to that and offload our RD. Most importantly, making sure our patients have a good experience, because that's what we're here for.
Absolutely. Absolutely. And I think that consistent offer across the county is absolutely essential to get that really optimise the utilisation of it. So what have been the challenges?
I think one of the biggest challenges is that traditional behaviour and cultures The NHS is a big machine, and it's always done things in a particular way. And I think when you look at any form of change in such a big organisation, it can shock people. It can be quite hard to get off the ground. And so we've combated quite a few hurdles, but we have overcome those hurdles now. And everybody should know what same-day emergency care is. They should know what services the ambulatory emergency care departments offer, and also how to refer through into acute medicine without hitting the front doors of accident and emergency. It truly is, we're trying to get that person to the right place at the right time. And actually, even though we've had some big hurdles to get over, it's all going in the right direction.
Excellent, excellent.
I think some of the biggest challenges we've had is historically we've been 2 different sites under the same trust. And between Dan and I and our colleagues in acute medicine, we are storming ahead with joined up thinking, and really making sure that there's an equal opportunity for our patients and our teams across the counties. That's something we're very proud of.
Absolutely.
It's been a challenge. But you know, by being open and honest and having innovative thinkers, we've managed to iron out some of the inequalities that had previously been in place. I think there's an ongoing challenge of patient expectation, and I think the NHS faces that. But with SDEC and with the increasing use of it by the ambulance service and 111 and the GP, patients are gradually understanding that care doesn't have to be delivered in the hospital, and that same-day emergency care gets most of the investigations done, and almost a diagnosis and a treatment planned for those patients without them being on a ward. And that reduces bed days, which is beneficial for everybody.
Absolutely, absolutely. I couldn't have summed it up better myself. Well done, Kirsty. So, what's the next steps? Where are we going next?
Well, I think we'd like to expand the team slightly further. We would like to try and push even more of the medical take through same-day emergency care. We would like to even build our own units that are purpose-built in order to facilitate more patients, more diagnosis, more everything. We want to get bigger. We always want to improve. We always want to get better at what we do. So I think the next step is that the sky's the limit, really. We just need to keep pushing the boundaries of what we're doing and not be afraid to just push harder and harder.
Absolutely, and what a superb aspiration and vision to have for your patients. Absolutely brilliant. Well, thanks both for your time this afternoon, and keep doing what you're doing, because you're obviously making a real positive impact, and I'll catch you all soon. Bye.
Bye.